Welcome to the Aesthetic Angle presented by Monarch Plastic Surgery. I'm Dr. Keith Hodge, the host today, and I'm joined by two very talented injectors, Whitney and Rachel. Welcome to the program.
Thank you.
Today's topic is lip filler. That's a really big topic. As a board-certified plastic surgeon with over 23 years of experience, I love doing surgery, but I gave up injecting about 5 years ago because there's so many fillers available and so many new techniques I could not keep up. But these ladies stay up to date on the latest. So, Whitney, welcome.
Thank you so much.
Rachel, welcome.
Well, thank you.
So everybody wants to see your results. So Whitney, what's your handle on Instagram?
My name is Whitney Soika, and my Instagram handle is aestheticrn.whitney.
Great. Rachel, how about you?
I am Rachel Lawson, and my Instagram handle is injections.byrachel.
Great. Not only talented, but they're also funny. They did some pretty good reels, so you might want to check that out. Okay, so let's start by asking, like I said, there's lots of options these days. Whitney, what is your favorite lip filler?
The two lip fillers that I probably gravitate toward the most are Vobella is one that I use from Allergan. And I also like Restylane Contour. Gives a really nice lip.
Rachel, how about you?
I really love Versa on the lips. I probably gravitate for it like 90% of the time. Yeah.
Are both these HA fillers?
Yes.
Yes.
They're all HA fillers we've talked about?
Mm-hmm.
Yeah. And depending on the age of the lip and what the lip shape looks like is kind of how I determine what filler I'm going to use.
Okay. How about you, Rachel?
Yeah. Age, lip shape, like how much they could hold. Are they going for plumpness and volume, height, or just a little hydration?
Wow. So many options.
Yeah.
Plumpness, height,
Yeah.
volume.
Yeah.
Hydration.
Yeah.
Okay. Okay.
Yeah.
Tell me more.
Well,
Can you describe those a little bit?
yeah. Well,
So if someone comes in and they have pretty thin lips, we're not gonna be able to, you're wanting to stay within their anatomy and what their lip can hold.
Absolutely.
So with that, you might be just working on adding a little volume and know their goal. So over time, it might be like, we're not hitting your lip goal today.
Mm-hmm.
We're gonna build this slowly over time. But if they're just looking to add a little structure, because age has played a part, volume has gone down, just kind of meeting them where they're at and what they're looking for. If they're just like, I just want to add a little hydration because they're looking a little more, what am I looking for?
What's an aged lip? Is it wrinkles? Is it?
Yeah, you can see the volume loss.
yeah, some vertical lines. As we age, we lose volume. And so I would say women come in, they just want a little bit of that hydration put back into it. And
Which gives it a smoother appearance?
Yes.
Not necessarily a larger appearance?
yes.
Yes.
And so I would say the hesitation comes from women that come in and, they don't want these huge ducky looking lips. And we just kind of talk about, okay, let's choose a product that's going to be right for you. That's just going to kind of give you a nice hydration, a nice volume, giving just a little bit more of a youthful appearance without being overdone looking.
Right.
Yeah.
We go for natural here at Monarch, right?
Yes.
Yes, that's our goal. I tell all my clients they are a walking billboard, and so I want them leaving looking natural and being happy with the results. And I don't want people looking at them thinking that they look weird and then them
Sharing
telling people that I did their lips. So, yes, our goal here is to look natural and to have
Beautiful.
everybody leave happy. Yeah.
When people tell me I don't want any filler, I'm like, we've only seen the bad filler. You don't notice the good filler.
Yeah.
Right. Yeah. Yeah.
I have that conversation multiple times a day,
Yeah.
every day.
Yeah.
Yeah.
Here
That's
at
the
Monarch,
artistry.
we do a good filler.
Absolutely.
Yeah.
What do you think about influencers like Kylie Jenner? What have they done to people wanting different types of lip filler, bigger lips, smaller lips? What have influencers done for you guys?
Kylie Jenner started this trend, I think it was back in like 2015, with these big, huge lips.
Overdone.
And overdone lips, yes. But it became kind of, I think, the social norm on social media. People were seeing that she had done this and now I want to try it. And so I think that's where the trend kind of started to get a little bit out of hand, maybe with the overdone lip. And I think that's where people come in and they say, I do not want these big ducky lips. And we kind of have to walk them back and say, okay, we're not trying to do what Kylie Jenner did.
Right.
Yeah.
That
And
may
there's
have,
still people who come in asking for that, though.
there are.
There are.
Yes, I do have
It's
a
still
few of
around.
those, yes. Some people just really want they
Yeah.
have big personalities, they have big
Yeah.
other things, and they want really big lips too.
Yeah.
I call it the West Coast look. It's just overdone on the West Coast.
Yeah.
Yeah.
These syringes everywhere.
Yes. Yeah.
Yeah.
For sure.
Yeah.
So I do think that she, nothing against Kylie Jenner, but did instill some fear in people now, especially with lip filler.
Well, if somebody has too much, they're like, I'm over it. What can you do about it?
We can dissolve that lip product that's in there. Most of them are hyaluronic acid that we can dissolve with Hylenex. And we can inject that into your lips, give it some time to dissolve, it come back in. We might have to do it 2 or 3 times to get all that lip filler dissolved. Once that is all dissolved and we get your lip kind of back to its natural form, then we can start having conversations about, let's do lip filler again, but let's inject the right product in the right place.
Start fresh.
Yeah, starting fresh. Yeah.
Yeah. Because I think even when it looks natural, you sometimes reach a point where it's just time to dissolve and start fresh. Like, for example, not to draw attention to my lips, but before I do mine again, I will dissolve and start fresh, just because over time, like you can start to feel it in your wet border sometimes. So you can't see it from the outside, but it's a good 4 years of doing lips. I haven't in like a year and a half now, but 4 years I've done syringes, and now I would like to start fresh before I add again. And I think that's okay to evaluate that too. Like, I think sometimes people are like, well, as long as they look good, I'm going to keep going. And I'd say have that conversation with your injector, have them look on the inside, not just the outside too. Make sure everything is how it should be. If you're in the clear, you're in the clear, and you can keep going. But I know the last time I had my lips injected, my friend who's an injector did them, and she was like, before we do this again, we should dissolve. Because there's just a couple spots that maybe.
So do you feel like there's some migration sometimes?
Yeah, I think it could be that. It could have been technique. It could have been product. I think migration is such a hard word because everyone has fear of migration. So I don't want to put fear in anybody. There's sometimes I don't know how much I think lip filler migrates as much as is it in the right place, technique, plain product for that person. Lips are a little trickier because sometimes it's a tight place to put filler at times, and it wants to go least resistance.
Yeah.
And so
I also think a client might come in and they're like, oh, I had lip filler a few years ago. I talk about, okay, do you know what product that was? No, I can't remember. And so instead of adding a product that I might suggest on top of that product, I might say, let's go ahead and just dissolve these. Let's start fresh.
Yeah.
Then I know what's in your lip, and let's keep it consistent. Keep coming back to me, and we, then I know what's in your lip, and we can work on that.
Yeah.
Right. Are there particular injection patterns you guys use to achieve that look that you want?
Yes, I typically inject horizontally. You can do some vertical threads to create some lift and volume, or maybe just tiny little aliquots, like little droplets. It just kind of depends on the shape of the lip and
Their anatomy,
what they're trying
need
to achieve. Yeah.
Are you always above the muscle? Are you in the muscle?
I'm above the muscle.
Yeah.
More
If you don't
superficial.
I would think so.
Yeah.
want to put
There is a trend right now of going under the muscle, though. I have not done a training on that, so I don't personally do that. But that is a new thing right now of going under the muscle.
I would think you have to be a risk for hematoma.
And if you do get it in the muscle, then that's when you could get into trouble with migrating, because then
The muscle's moving, it's contracting all the time.
then it's pushing that product out, and it might cause some migration. So you do have to be careful about where you're placing that. Yeah.
Are there any certain techniques people come in asking for, like the Russian lip or something like that?
Yeah.
What are people asking for these
few.
days?
Yeah.
Yeah.
I feel like, I don't know if they use the term, but they'll show you a picture and they do ask for that. I have a conversation with them about their lip anatomy and what we can achieve or what they want. So they leave happy still. I think in theory, they like the way that lip looks on that specific person, but everyone's anatomy is different.
Yeah. And I think it's okay to have a conversation with them and say, based on what you look like, and I know you might want this, but I feel like that might not be the best look for you. That might be a conversation. Sometimes they just really want it though. And if that's really what they want, and if I don't do it, they may leave and go get it done somewhere else.
Right.
So that's tough sometimes, but we can work through that.
Yeah. When you feel like the lip's been overdone, especially over a period of time, do you think the lip stretches? Think the natural anatomy stretches
I think that
or changes in any way?
the skin does stretch to allow for that filler. If we dissolve it over time, that product is going to break down and get back to your natural shape. So I think if they're overfilled, then yes, you may have some lax lip skin, but
In these little product.
yeah, but
It shouldn't be too
seen
far
all
off
of
from
that.
your baseline though. I feel like it might look volume depleted but was it looking like that before you filled too?
Yeah.
Yeah, I feel like it gets pretty close to baseline.
yeah, but I haven't seen anybody with
I haven't
flabby lips.
Yeah. I also personally haven't had somebody dissolve and not want to refill either. So when they come in, we dissolve, we have a goal to refill. I haven't seen somebody just leave it completely dissolved.
Yeah.
I think they see the volume depletion, which probably was there beforehand too.
Right.
And wanting to refill.
Yeah, I would agree.
What's the typical volume you guys are using?
What is the
Typical
amount of
volume
volume?
or the range?
Oh, I am trying to tell people to let's at least purchase a full syringe. We likely will not use that full syringe, but
I have a sweet spot I feel like lips are in. Do you?
yeah, yes, it's more than a half, but it's
Less
than a
full.
one full.
Oh, really?
Yeah.
And so I would say let's start with purchasing one full syringe. I'm probably not going to inject that full syringe. But it's cheaper to purchase a full syringe than to purchase a half syringe and then later
Be
want
unhappy.
more and then come back and buy another half syringe.
Yeah, absolutely. I feel like people think they're playing it safe getting the half syringe. But they after the 2 weeks of healing and the swelling has gone down, they're like, well, I liked them when they were bigger. And so you're like, well, so just trying to get people to understand half of a syringe is half of a blueberry split between your upper and lower lips. You're really not going to see a big change.
Right.
So if you're thinking, they're thinking of the people with bad filler. So they're trying to avoid that, but they're playing it so safe. It's going to cost them more in the long run. Yeah.
So I think somebody with a completely naive lip that has never had filler, let's start with purchasing one and probably not injecting the full one. And then later, if you want more, maybe let's do a half syringe. But I would say, there's a sweet spot for more than a half, less than a full.
Yeah. And I don't always love our products that come in a half syringe. So I might not address it that way and just be like, this is the product that's better for you. So get half and full out of your mind and think I'm paying for a result.
Right.
Yeah.
Instead of being dead set on this budget or this amount, I want you to be happy with your results. So if you could get those out of your mind, we'll get you there.
Yeah.
Yeah.
Because there's only a few products that are offered in half syringes, and they wouldn't necessarily be the best for Everybody's
Gotcha.
lip.
For everybody.
Gotcha.
Yeah.
So for first time clients, they like the results with their when they're swollen.
Mm-hmm.
They come out. Like, I wish I looked like I did a few weeks ago.
Yeah.
Mm-hmm.
I get the same thing with breast augmentation sometimes. Like
Yeah.
I like my size, but I really like the swollen look.
Right.
Yeah,
Right.
yeah,
Yeah.
You're like,
And-
hold on to that, and you can maybe in the
Yes.
future
Yes.
go larger, or we could
Yeah.
add filler again. Yeah.
And I usually tell them that when I'm like, okay,
Mm-hmm.
you're going to be swollen the most, like the first night, second day. As the swelling starts to go down, really going to love them at like day 2.
Hmm.
And usually
Yeah.
in 2 weeks, they come back and they're like, "Oh, I really wish I would have done more." I'm like,
Hmm.
yeah.
I also, with first time people, tell them don't love them or hate them for 2 weeks, because every day you're going to have a different emotion with them. You're going to leave and be like, these are great. You're going to go home and be like, what have I done?
Hmm.
Whoa.
Yeah.
Then, you
Yeah.
know, it will be like this for 2 weeks. And I have lots of people who send me messages. I don't know about you. I
Oh,
get
yeah.
lots of DMs in that 2 weeks of like, is this okay? Is this normal?
Yeah.
Did I go too far? Should we dissolve? Is this a VO? Is this a
Yeah.
bruise?
Yeah.
So like I try and just preface that before they leave. Like,
Hmm.
be ready for that roller coaster for 2 weeks. More than likely at 2 weeks, you're either going to be happy or you're going to miss the swelling, but you won't
Yeah.
hate them.
Hmm. Hmm.
Yeah. Usually
Yeah.
before they leave, I try and manage their expectations
Hmm.
before they leave. So I'm not managing them for the next
Right.
2 weeks.
Right.
But yes, people do reach out and we can usually work through that until they come back for their 2-week visit.
Yeah.
And they're usually almost always happy.
Yeah.
Yeah. I don't see it so much with breast augmentations, but my tummy tuck patients, I tell them, look, you're a week out, you're still tired, you're still uncomfortable. There can be some buyer's remorse.
Yeah.
You'll come back in 2 weeks and go, okay,
Yeah.
I'm starting to feel better.
Yeah.
I'm good now. I'm glad I did
Yeah.
it.
Yeah.
But there could be some like, oh, what did I do?
Right.
Just-
Right.
It's a journey a little bit.
Yeah, it is. It
Yeah.
is. Luckily, it's short, but
Yeah.
Right.
Yeah.
But during that time, I think, I mean, I do it even.
I do it every time. I feel so bad when people inject me. I do the same thing. I'm like, I think we took it too far
Yeah.
this time. And they're like, would you say to your patient to wait?
Yes. So I think we might be the worst sometimes because I this is what I tell my clients, and then when I
Oh yeah.
have something, then I
did
don't always follow it.
I did Whitney's lips.
Yeah.
And immediately I could tell her face was like, what have I done? Even if she didn't say it.
And we just did mine with
Skin
Skin
Vive.
Vive,
Yeah, we
yeah.
did Skin Vive.
Yeah.
It's just a hydration booster versus like traditional HA filler.
Yeah.
Yeah, just a little hydration.
but yeah,
okay.
that's an off label.
Right. Well, for a first time patient that's considering filler, what do you guys discuss prior to injection? I mean, kind of walk me through the consult process.
I mean, first, just, assessment, looking at their lip, really taking good pictures beforehand. I talk to them about any inflammatory issues they might have. I make sure that they are not traveling for like at least a week. That they might not have a big event coming that weekend, like a wedding or
Yeah.
party, because they likely will have bruising. They will be swollen. And then I just kind of walk them through the process of, okay, I'm going to numb you. We can either numb you topically or we can do like a dental block.
Yeah. What's your preference?
Recently, I've been liking the dental block just because it's quicker. And you're completely pain-free. You're not feeling anything. With the topical numbing, you put it on and you have to wait, a good 20 to 30 minutes. They're just kind of sitting in your chair.
Yeah.
And that's fine. But,
There's still some discomfort with it too.
and then they still can feel the injections.
Yeah. So, Rachel, you prefer dental block?
Here recently, yeah, I did just topical for years. And then I started the dental block, and I've had patients who their first time chose. I let them choose. I kind of am like, we can do a dental block. you could be numb for several hours. And I've had people like, I don't want that, so I'll do the cream. And then they came back for their touch up. And because of the time frame I had, I was like, that's fine. I can fit you in here, but we got to do the dental block. And they were like, oh, wow, this was so much more comfortable. So,
Yeah.
people
With
do.
a lot of anxiety, I just really say let's do the dental block.
Yeah.
Yeah.
Then you aren't feeling anything at all.
Yeah, especially with any anxiety.
Yes.
Like, this will be better for you.
With that, I tell them from the very beginning, your lips are already going to feel huge with the dental block.
Massive. It
So-
is like they are
Yeah.
out here.
Yes. So I'm like, okay, your lips are feeling huge to begin with. I haven't even touched them.
Yeah.
Now I am going to inject them. And now you are going to be swollen. Namely because I am injecting a needle in your lips, but then I am putting a product in there.
Yeah.
So when you look in the mirror and we're all done, don't freak out. And so far I haven't had.
Yeah. I do feel like I have to show them their lips throughout the process
Yes.
a little bit more to reassure them, because I'll have them go, they're not too big, right? You're not putting too much in, because they just feel so large, which is
Yeah.
totally fine. It's also kind of gratifying to hand them the mirror and then be like, oh, okay, this is good. You're like, okay, good.
Yeah.
We're like meeting each other
Yes.
with what you want.
And that's why I think it's really important to take really good before pictures. And then I take after pictures and just show them, okay, look at this is what you looked like before and this is what you look like now. And then in 2 weeks, take more pictures and then we kind of see what their journey was like.
When you talk about anatomy, what are you looking at?
Yeah.
What's going on in your head when you're looking at their anatomy?
Yeah. So before we start, if anyone has anything that I think will show up more after filler, I'm also going to point it out. Going back to assessment a little bit, some people have this Fordyce. It's like little sweat glands on your lip. They're like little white dots. I personally have them on mine. And my first time my lips were injected, they pop out more. They show more, and people are like, "What happened here?"
Yeah.
So I also like to point out their anatomy of like your right side is higher than your left.
Yes.
You have Fordyce. These are going to be more pronounced with filler. Some people have a discoloration in their lip, so if you add some filler, it might look like their lip just isn't as full. But so just pointing out all those things before we even fill, so they're also not like, why does it look worse now that I'm injected? And not necessarily worse, but different.
I'm surprised you haven't said asymmetry yet, because everyone has asymmetry.
Yes. Well, that's
Yeah.
yes, absolutely. And there's some people who are just like, oh, I'm so happy. And then you have people who hyperfixate that they want it to be as symmetrical as possible. And you can try,
Sure.
but even when you're adding filler, it's still, your anatomy is still your anatomy. Your right side might still stay just a little bit higher than your left.
Yeah.
You know, we're going to get it as close as possible, but just having that expectation that they might not be twins on
Right.
each side.
Yeah.
And
That's
going
what I always say
through that
about breasts.
process.
They're always sisters. They're never twins.
Yeah.
I mean, they aren't.
Right.
Right.
There's some people's lips who like naturally curl under, and it's really hard to get them to invert out.
Yeah. Looking at their Cupid's bow, if they have a really defined vermilion border or wherever their wet dry border is, those are things I look at too.
Yeah.
Anything you do to better define the Cupid's bow?
I don't know what you do.
It depends. I ask them
Yeah.
if they like it, because I've had patients who really like more of a rounded than a pronounced, like traditional, triangle shaped Cupid's bow. So I make sure first, because I love a good crisp Cupid's bow. But I never want to not give someone what they want. But I really like doing more of a vertical right at the Cupid's bow personally.
Yeah.
How about you?
Same.
Yeah.
I like to do a vertical.
Like right down into.
Yeah. Down into it. And that's where I think also doing the dental block is good, because that is very spicy.
Yeah. That hurts the most.
Yeah. So with the topical, you still are feeling that, especially at that Cupid's bow area.
What's a lip flip?
A lip flip is where we inject Botox just right at that border of your lip, and it just helps kind of relax that muscle, that orbicularis muscle around your lip, and it just helps kind of flip that and show a little bit more of your lip.
It's
Some
not going to add volume. So if someone's looking for volume, filler.
Yes.
Yeah.
You guys do that together? Or would you do Botox and a filler, or would you
Have.
separate it?
Yeah, you can.
Have
Some people.
Go ahead.
There you go.
Some people need the lip flip before you even do filler. Like their lips are so thin and they curl under that you're able to see them a little bit more. So sometimes I might have them do a lip flip and then come back in a week or two and then do some filler when their lip can show a little bit more.
Some people really either like the lip flip or they don't. Because once that it's Botox that's put in there, sometimes you have a hard time animating, smiling, using a straw. And it's just kind of a weird feeling. And some people come back and they're like, yeah, I did not like that. And
What's the typical dose for a lip flip?
I just do 1 unit. Well, like a total of 4 to 6 units. So 1 unit.
I'll go
the
up
top.
to 8. I won't go more than 8.
Okay.
But I prep them. This will be the hardest too. If you're a straw drinker,
Yes.
you're not gonna. You're drinking from your cup. You will not.
Yeah.
I say 4, 6, or 8. Yeah.
So just
So
tiny.
it's really inexpensive.
Very
inexpensive. Yes.
realistic expectations. Botox typically lasts about 3 months for most people. A lip flip's lasting like I think 4 to 6 weeks. They say 6 to 8 weeks. I say 4. 4 to
It's
6.
because you're using that muscle all the time, right? I mean, you're just really working
It's a very
that muscle.
superficial injection anyway, and you're talking, eating, burn through it. But I do have some younger girls who maybe can't afford the lip filler, and they come monthly, like every 4 weeks for a lip flip. If they had saved that, we probably could have done some filler, and that's totally fine. Filler is scary to some people.
When you do those injections, also they do leave a little bit swollen in that lip, and then they kind of see, what it might kind of look like if they had some lip filler, and that
That's interesting.
might
Good
be
gateway sometimes.
yeah. Because it's across that top part of that lip, and I'm like, you're gonna be a little bit swollen. Then they see a little bit of volume, and I'm like, this is kind of a gateway to lip filler. Yeah.
What do you think about the long lip on an older person?
I have
It's
quite a few of
hard.
those.
Yeah.
Yeah. I try sometimes to add a little filler column back in for them. Just it tends to like flatten out and
Yes.
it's long. So sometimes as I'm adding some filler to their Cupid's bow, I'll kind of just go straight up and try and build it a little.
Well, what
Surgery
I
would be
do-
best. That's what I tell them.
Yeah.
What I
you
do is the lip lift.
Yeah.
Oh, yes.
While removing skin under the nose, the scar follows the curvature of the ala, the nostril, everything. It's
Yeah.
well hidden. And, you're taking typically 6 millimeters. And so you got to make sure you leave enough. We're going to have a lot of tooth show. But it's a great way to rejuvenate that upper lip permanently. And it's a well hidden scar. It's easy to do. I can do it in the office or local. I will commonly do it with facelifts, but I can do it in isolation too. So if you guys have somebody that's has a really long lip,
Interesting. Okay.
we'll just do it in the office or local.
How often do you do those?
Probably monthly. I mean, it's not that
Okay.
common of a procedure, but
Yeah.
again, with facelifts.
Oh,
I
I've
do
had a
some
couple. I'm
facelifts.
like, surgery would be best
Yeah.
in navigating that.
Yeah.
But
I'm usually navigating that with like a neck lift or a lower facelift, but it's good to know that
yeah.
that option is out there.
What about back to you? Do you do much fat grafting for the lips or do you avoid lips?
I tend to avoid that
Yeah.
because if you don't have perfect take, if like one side takes more than the other, you're going to have some asymmetry you got to deal with.
Yeah.
I love it in the face. I love fat graft in the face. I wish every facelift patient would let me fat
do
graft.
it.
They just won't let me.
Okay.
But I mean, unless you're under 50, if you're 50 and over, I would say you need some volume. So
Yeah. I've injected only one somebody's lips that had fat grafting. Oh, it was really hard to inject though. It was like meeting such resistance. And I don't know if that's scar tissue or just the fat or
I bet it's a
I'm not
scar
sure.
tissue.
Yeah. I was like, it was really hard to inject post
I mean, I
that
would do it.
pregnancy.
I mean, we have the equipment.
Yeah.
I understand the technique, but it's just always something like it's a little uneven. We're
Yeah.
going to do something else again to make it even.
Yeah. 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 This
But
was years ago, so who knows like
yeah,
what technique and where they had it done, but um
we
it wasn't, it was pretty as asymmetrical afterwards though. Yeah, volume wise in her lips. So I was just like, oh, interesting.
Mm-hmm.
Yeah.
that's where you do the nano fat. So we have the emulsifier to make it really small particles and very uniform in thickness.
Mm.
And then obviously you'll be conservative as well. So you
Yeah.
can always do more, but can't really take it out
Yeah.
if it's
Yeah.
fat.
Yeah.
Yeah. Yeah. Yeah.
Anything else we haven't covered?
Um,
Well, I think to be complete, we should discuss complications. I'm sure you discuss
Yeah, yeah, yeah,
complications
yeah.
in your consult.
Yes.
yes.
So you assess,
Mm-hmm.
you ask them about their goals,
Mm-hmm.
you give suggestions,
Yes.
Yes.
you come to a consensus.
Yes.
But before you do that, you have to discuss complications.
Yeah.
So what do you guys tell
Yes.
your patients?
I mean, there is always a risk of, well, almost all the time, bruising.
Well, that's expected
Yes.
to me. That's not really
Yeah.
complication.
I'm like,
Yes,
you
yes,
were
yes.
going to get swelling,
Yeah.
bruising,
Yeah.
tenderness.
Complication would be a VO, a vascular occlusion, where that product, if it wasn't placed in the right place, could occlude a vessel. And we are constantly checking for correct placement as we're injecting lips, but there is always a chance. And if that happens, we have Hylenex, which is a product that immediately breaks down that filler and
And signs of that are what? A vascular occlusion. What are you gonna say?
discoloration of the lip.
I always tell them like, and I don't know, maybe being a nurse, I think cap refill, like checking someone's blood flow in their finger, and I tell them like when I press on it, it's going white. We want to see color return. Same thing for your lips. Like
Yeah.
when you press on it, you're bruising. Bruising's normal to an extent. We want to see the color return. So if your bruise is turning a dusky white color, it's not
Yes.
getting the blood flow it needs.
Right.
And more times than not, it's going to be a vessel's compressed more than it is actually filler in your vessel. So I always start with let's try heat and massage. If we can't make it better from there, then we're going to go to Hylenex. But you're looking for that bruising that's getting dusky, but also that bruise is spreading.
Yeah. So
So
it's changing
typically
color.
it's changing color, it's spreading.
Usually a wider appearance, right? And intense pain.
Yes.
Pain out of proportion to what you just did.
Right. Mhm. And it's getting worse over time.
Yeah.
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 And thankfully, that's very rare.
Yeah.
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 Never had one.
Yeah.
So vascular occlusion, what else are potential complications?
So I recently had somebody that just had, a bump area of the product that settled in the wrong place. I don't know, what happened, but we recently just went in and just dissolved that little area of the filler. And we're going to give it some time to resolve. But she's like, but I really like the volume of where that is. I'm like, I know, but it just doesn't feel good. So dissolving that, and once that settles out, then we can go back in and lay more product. So
Hematoma,
Hematoma.
get a vessel.
yeah,
Yeah.
yeah,
Yeah.
Yes.
Granulomas is nodules. It's rare to have, but it can happen where even, down the road, it could pop up. More so with some products than others. And I feel like that's why there's some products I just don't reach for the lips anymore. Just as you inject over time, you learn what you're comfortable with, not comfortable with, their outcomes.
I've had a client that
Autoimmune, sorry
Yeah.
to cut you
No.
off. Autoimmune that they may not know they have. Allergen products you don't really want to use with people with autoimmune. It can cause a lot of flare-ups and issues and nodules. So sometimes that pops up later and they don't know that they have an autoimmune.
yeah,
So
I have a client that I did her lips, and then 6 months down the road, she started developing all these nodules, and we were like trying to figure it out. Started her on a steroid taper, they resolved, and then like 6 months later flared back up, and it just kind of was this weird cycle. So I ended up dissolving her lips, and she wants more lip filler, and I'm like, we're not doing it.
Yeah.
But it might be the product.
It might be,
Because there's
Yeah.
one product that is
yeah,
you should
that's
try. You should try.
a different one.
Yeah.
Yes. But yeah, so those are some things that you're just like, oh, I didn't, you can't predict it.
Yeah.
Yeah.
Yeah. It's unfortunate, but it can happen.
Yeah.
Well, I think we covered it. I think we did a pretty deep dive today on lip filler.
Yeah.
It's a common procedure. It's a safe procedure, but there's always risk with anything we do, whether it's with a needle or with a scalpel. But you want someone who's experienced, someone who's keeping up to all the latest trends, techniques, and products. And that's what we provide here at Monarch Plastic Surgery. I hope you enjoyed the podcast on lip filler. Thank you.